emphasizing how critical it is to detect these signs early to prevent severe damage or even death. While strokes can affect both men and women, the symptoms and risk factors often differ, making it essential for women to be especially vigilant about recognizing the signs. The video highlights that early detection can make a significant difference in the outcome of a stroke and encourages viewers to share this life-saving information with their friends and family. What is a stroke? A stroke, medically known as a cerebral vascular accident, CVA, is a serious condition that occurs when the blood supply to part of the brain is interrupted or reduced. This disruption deprives the brain tissue of oxygen and essential nutrients, causing brain cells to begin dying within minutes. If left untreated, the damage can lead to long-term disability or death. While strokes are common in both men and women tend to have a higher risk of dying from a stroke. According to the American Heart Association, women in the U.S. have a higher stroke death rate than men, making early detection even more crucial. The causes of a stroke generally fall into two categories. Ischemic stroke. This occurs when a blood clot blocks or narrows an artery leading to the brain. It accounts for approximately 85% of strokes. Hemorrhagic stroke. This happens when a blood vessel in the brain bursts, causing bleeding into or around the brain. Hemorrhagic strokes are often linked to high blood pressure or aneurysms. What sets women apart is that they have certain unique risk factors that can contribute to their stroke risk, such as pregnancy, the use of hormonal contraceptives, menopause, and conditions like preeclampsia or eclampsia during pregnancy. These factors can put women at a higher risk, and the symptoms they experience during a stroke may differ slightly from the classic signs that are commonly recognized. 1. Sudden weakness in the face, arm, or leg. One of the most alarming and commonly recognized warning signs of a stroke is the sudden onset of weakness or numbness, typically on one side of the body. This can develop unexpectedly and without warning, affecting different parts of the body, particularly the face, arms, and legs. The sensation can range from mild tingling or numbness, where movement feels impaired or clumsy, to more extreme cases where there is complete paralysis. In many instances, a person may suddenly find that they cannot perform basic actions like raising their arm, maintaining their balance, or even walking properly. This sudden inability to control movement can be distressing, as it can happen rapidly and severely impair the person's ability to function. A particularly telling sign of this kind of weakness is when the muscles in the face become affected. People experiencing a stroke may attempt to smile, only to find that one side of their face is drooping or unable to move. This drooping is often one of the first indicators that something is wrong. The uneven facial movement or the inability to control the muscles in the face is a clear sign that immediate medical attention is needed. Another method to assess weakness is by asking the individual to raise both arms above their head. In cases of stroke, they may find that one arm is significantly weaker than the other, or even falls involuntarily after a brief moment. This test, along with the smile test, is commonly used in emergencies to quickly determine if someone is suffering from a stroke. In addition to weakness in the arms and face, legs can also be affected, leading to difficulty walking. A person may suddenly find that one leg feels heavier or unresponsive, causing them to stumble or lose their balance. Walking steadily may become impossible, and even standing upright may pose a challenge. For women in particular, stroke symptoms can sometimes present in more subtle ways. Along with facial drooping or weakness in an arm or leg, women may experience difficulty speaking or controlling their facial muscles, making it hard to form words clearly or maintain facial expressions. This weakness may spread rapidly, affecting a larger portion of the body and making movement difficult or impossible. It is important to understand that the weakness or numbness typically affects just one side of the body, corresponding to the side of the brain that is being impacted by the stroke. The brain controls the body in a cross-wired manner, meaning that a stroke in the left side of the brain often causes weakness or numbness in the right side of the body, and vice versa. Recognizing these symptoms early and understanding their cause is crucial for prompt medical intervention. Without immediate treatment, the damage to the brain caused by a stroke can become more severe, leading to permanent disability. If left untreated, this weakness can worsen, becoming irreversible and resulting in long-term complications such as paralysis or loss of function in the affected areas. Time is critical when dealing with a stroke. The longer the brain is deprived of oxygen and nutrients, the more extensive the damage becomes. As the brain cells begin to die, the effects on the body become more pronounced, and the chances of recovery decrease. This is why it is essential to seek emergency medical care as soon as stroke symptoms are recognized.
2.
Sudden mental confusion or difficulty speaking and understanding. Another critical early warning sign of a stroke in women is the sudden onset of confusion or difficulty in speaking. This can manifest in several ways, from slurred speech to an inability to form coherent sentences or even comprehend what others are saying. The root cause of these symptoms lies in the stroke's disruption of the brain's language and communication centers, making it difficult for the individual to process or articulate thoughts properly. This condition, known as aphasia, presents in varying degrees and forms. For instance, a woman who is experiencing a stroke may begin mixing up words, substituting incorrect or nonsensical words, or losing the ability to speak altogether. Simple tasks like naming familiar objects or expressing needs become challenging, and this sudden communication barrier can be both alarming and frustrating for the individual. In some cases, the woman might appear confused or disoriented, unable to comprehend even the most basic conversation. This inability to follow or respond appropriately to others can be mistaken for general confusion, but it's often a direct consequence of the stroke affecting the brain's language processing regions. In addition to the inability to express thoughts, women may also struggle to interpret language. They may hear someone speaking clearly, but cannot make sense of the words being said. This comprehension difficulty can be particularly distressing for both the individual and those around them. For instance, a loved one might ask a simple question like, "What's your name?" or "Where are you?" And instead of answering correctly, the person might respond with unrelated or garbled words, or fail to respond entirely. This form of aphasia, known as receptive aphasia, is one of the more subtle yet significant signs of a stroke. Diagnosing this sign during an emergency requires some quick assessments. One common method is to ask the individual to repeat a simple phrase or follow basic instructions. Commands like raise your hand or say your name are easy for someone without brain impairment, but for someone experiencing a stroke, these tasks may be nearly impossible to perform correctly. If the individual struggles to respond, uses the wrong words, or fails to follow the command, it can be a clear indicator that a stroke is occurring. It's important to note that while aphasia can affect both men and women, research suggests that speech difficulties during a stroke tend to be more pronounced in women. This heightened risk underscores the importance of paying close attention to any sudden changes in speech or comprehension in women, particularly as they age, or if they have other stroke risk factors like high blood pressure or diabetes. Another layer of complexity is that women might not always exhibit the same outwardly dramatic signs of stroke that are commonly recognized, such as facial drooping or limb weakness, but may instead experience more subtle symptoms like confusion, difficulty speaking, or trouble understanding what's being said. This can make it harder to recognize the onset of a stroke in women, delaying crucial medical intervention. Delayed treatment in cases of stroke can result in more extensive brain damage, longer recovery times, and greater long-term impairment, which is why recognizing these early symptoms is so vital. Moreover, this sudden loss of communication abilities can have a profound psychological impact on the person experiencing it. For women, especially those who are typically talkative or communicative, this breakdown in their ability to express themselves can lead to heightened feelings of fear, isolation, and helplessness. It can also strain relationships, as loved ones may not understand why the woman is struggling to communicate or may misinterpret the aphasia as confusion or dementia, further complicating the situation. This early warning sign serves as a reminder that stroke symptoms are not limited to just physical manifestations like numbness or loss of coordination. Cognitive and communicative signs like aphasia are just as important and can be early indicators of a more serious issue. Therefore, recognizing sudden speech or comprehension problems, especially in women, and acting quickly by seeking emergency medical care could save lives and prevent long-term disability. 3. Vision problems in one or both eyes. Sudden vision problems, such as blurred vision, double vision, or even complete loss of vision, can be another critical warning sign of a stroke in women. These vision disturbances can affect one or both eyes and often come on suddenly, without any prior warning or accompanying symptoms. They are particularly alarming because they can appear out of nowhere, making the affected individual feel disoriented or confused about why their vision has changed so drastically in such a short period of time. The reason for this sudden change in vision is linked to the stroke's impact on the brain. Specifically, the parts of the brain that control vision can be affected when blood flow is reduced or blocked. Just as a stroke can damage areas of the brain responsible for language, movement, or memory, it can also affect the regions responsible for processing visual information. When these areas are deprived of oxygen-rich blood, vision can become impaired, resulting in a range of issues from partial blindness to full vision loss. Depending on which part of the brain is affected, the person may experience blurred vision, where things seem out of focus, or double vision, where they see two images of the same object. In some cases, women might experience a complete blackout of their vision in one or both eyes, which can be terrifying. Unfortunately, vision problems during a stroke are often overlooked or mistaken for less serious issues. Many people, particularly women, may attribute sudden changes in their vision to other, more common causes like eye strain, aging, or even fatigue. They might assume that their blurred vision is a result of spending too much time in front of a computer screen or reading in dim light, rather than recognizing it as a potential sign of a stroke. This is a dangerous misconception because delaying medical attention during a stroke can result in permanent damage to the brain and longer-lasting visual impairments. Women experiencing vision problems due to a stroke may encounter a variety of difficulties. They might suddenly find it hard to read text that they previously had no trouble with. The letters on the page may appear blurry or jumbled, making it difficult to follow a sentence or even distinguish words. This can be especially frustrating for women who are used to being able to read easily and may not immediately understand why they are struggling. Peripheral vision loss is another common issue, where the individual loses sight on the edges of their vision. This can cause them to bump into objects, trip over things, or misjudge distances when walking, as they are no longer able to see things in their peripheral field of vision. The loss of side vision can make everyday tasks, such as driving or navigating crowded spaces, much more dangerous and challenging. In more severe cases, the vision loss can be complete, affecting one or both eyes. This total vision blackout can happen without any warning and may leave the person completely unable to see, which is incredibly distressing. For some women, the vision loss might only last a few minutes before returning, while for others, it can persist for longer, depending on how severely the stroke has impacted the brain. Regardless of the severity, any sudden vision problem should be taken seriously, as it could indicate that a stroke is affecting critical parts of the brain responsible for visual processing. It's important to note that while vision problems can be caused by a range of conditions, they should never be ignored, particularly if they appear suddenly. Stroke-related vision issues often occur alongside other symptoms, such as difficulty speaking, weakness in the arms or legs, or confusion. However, they can also occur in isolation, making them harder to recognize as part of a stroke. Women are especially vulnerable to this, as stroke symptoms in women can sometimes be more subtle or atypical compared to men. If a woman experiences sudden vision changes that seem unusual or unexplained, it's crucial to seek medical attention immediately. Quick action can make a significant difference in the outcome of a stroke. Vision loss, especially when combined with other stroke warning signs, should be treated as a medical emergency. Getting to a hospital quickly could save the person's sight, as well as prevent further brain damage and potential long-term complications. In summary, sudden vision problems, whether it's blurred vision, double vision, or complete loss of sight, can be an early sign of a stroke. These issues, which may affect one or both eyes, occur due to the brain's visual centers being impacted by the stroke. Unfortunately, these symptoms are often overlooked, but they should not be ignored, as they are a serious warning that a stroke may be occurring. Immediate medical attention is crucial to prevent lasting damage. 4. Difficulty walking, dizziness, or loss of balance. Sudden difficulty walking, dizziness, or a loss of coordination can be another significant warning sign of a stroke in women. These symptoms often come on suddenly, without any prior warning, and can be extremely alarming. A woman experiencing this may feel suddenly disoriented or unable to walk in a straight line, leading to frequent tripping or stumbling. In more severe cases, she might experience a sensation that the room is spinning around her, a condition known as vertigo. This can make it nearly impossible to maintain balance or stand without assistance, leaving the individual feeling unsteady and vulnerable. These symptoms are indicative of a stroke impacting the parts of the brain responsible for controlling balance, movement, and spatial perception. When the brain's blood supply to these regions is interrupted, the individual's ability to coordinate movement is compromised. This can result in a sudden loss of balance or the inability to walk properly, which may present as a staggering or lopsided gait. Even simple actions like standing up or turning around can become difficult and dangerous as the brain's signals to the body are disrupted. Vertigo, or the sensation that everything around is spinning, is particularly distressing for women experiencing a stroke. This feeling of spinning can make it challenging to maintain any sense of equilibrium. Even when sitting or lying down, the sensation might persist, adding to feelings of confusion and helplessness. Vertigo caused by a stroke is different from occasional dizziness that might come from being tired or dehydrated. It is often more intense and longer-lasting, making it difficult for the person to move or even sit still comfortably. Women experiencing these stroke-related balance issues may also have trouble with tasks that require fine motor skills, such as picking up small objects, turning doorknobs, or even using utensils while eating. This lack of coordination can lead to frustration as simple daily activities suddenly become difficult or impossible. It may also increase the risk of dangerous falls, especially for women who try to stand or walk without realizing that their balance has been compromised. Falls can lead to serious injuries, such as fractures or head trauma, which only compound the medical emergency at hand. In some cases, the loss of coordination can be subtle at first. A woman might feel slightly off balance or experience occasional dizziness, but may not immediately connect these symptoms to a stroke. However, when combined with other warning signs such as sudden difficulty speaking, vision problems, or numbness in one side of the body, these balance issues should be taken very seriously. Any sudden and unexplained difficulty walking or standing is a red flag that the brain is not functioning properly and medical attention should be sought immediately. 5. Severe headache with no apparent cause. A sudden, intense headache that feels unlike any previous headache may be a warning sign of a stroke, particularly if it is linked to a cerebral hemorrhage, which involves bleeding in the brain. Many individuals who have experienced this symptom describe it as the worst headache of their life. It often comes on very quickly, escalating in severity within just a few minutes. The intensity and rapid onset of the pain make it different from typical headaches, such as migraines or tension headaches. This type of headache is commonly associated with hemorrhagic strokes, a specific kind of stroke that occurs when a blood vessel in the brain ruptures. When this happens, blood leaks into the brain tissue, creating pressure inside the skull. This increase in pressure leads to intense pain, which can feel overwhelming. In addition to the headache, individuals may also experience other symptoms, such as nausea, vomiting, or a heightened sensitivity to light and sound, known as photophobia and phonophobia, respectively. The combination of these symptoms can make the experience even more distressing. Unlike a regular migraine or tension headache, which may have identifiable triggers such as stress or dehydration, this stroke-related headache comes on without any clear cause. It doesn't gradually build up like many other types of headaches. Instead, the pain hits suddenly and with an alarming intensity. This rapid and severe headache is often a signal that something is seriously wrong within the brain, especially if it is accompanied by other signs of a stroke, such as confusion, difficulty speaking, vision problems, or loss of coordination. A hemorrhagic stroke is particularly dangerous because the bleeding in the brain can cause significant damage to brain cells. As blood accumulates, it puts pressure on the surrounding brain tissue, impairing its ability to function. Depending on the location and extent of the bleeding, this type of stroke can result in severe neurological impairment or even death if not treated promptly. For this reason, it is essential to seek emergency medical attention at the first sign of such a headache, as time is critical in minimizing the damage caused by the stroke. While headaches are a common health issue and most are not life-threatening, The sudden onset of a severe, intense headache should never be ignored, especially when it feels different from any previous headaches. The individual may also notice other stroke symptoms, such as weakness on one side of the body, slurred speech, or difficulty walking. These additional symptoms, along with the headache, are red flags that immediate medical care is needed. In summary, a sudden and extremely intense headache that comes on without warning could indicate a hemorrhagic stroke. This type of stroke, caused by bleeding in the brain, is life-threatening and requires urgent medical intervention. The pain is often described as the worst headache ever experienced and is usually accompanied by other symptoms such as nausea, vomiting, and sensitivity to light and sound. Recognizing this type of headache as a potential sign of a stroke and seeking immediate medical help can be life-saving and prevent further complications.